Hello, my name is Sophiana Skinnis, and today I will be presenting the research project that I completed with the help of my faculty mentor and advisor, Professor Barry Thompson. The goal of my research was to find out if certain plants can help fight and prevent cardiovascular disease, and if so, which ones, and to discover which plants are the most effective in prevention and treatment of cardiovascular disease. Cardiovascular diseases are the leading cause of morbidity and mortality in the world today. Important risk factors include high lipid glucose, waist circumference, and blood pressure. Balanced diets, particularly the Mediterranean diets, that are rich in plant foods have been proven to prevent and heal cardiovascular diseases and decrease blood pressure, weight, morbidity, mortality, and age-related issues. The power of these foods comes from the compounds within them, like polyphenols and flavonoids. Research has shown that several plants have chemical properties that can fight cardiovascular diseases, and many have the potential to become pharmaceutical drugs. There are already a handful of pharmaceutical drugs derived from the Trapa belladonna and Digitalis lanata species that are able to combat heart disease and the symptoms of it. These are the drugs atropine, digoxin, and digitoxin. Methods I used to complete my research was to find scholarly articles related to my topic, analyze the drug and dietary recommendations of a cardiologist, analyze dietary lifestyle habits of patients and family members, and to organize all my data from the clinical and personal observations and the scholarly articles I found. Polyphenols are found in vegetables, fruits, cereals, teas, and many other plant-based foods. They are secondary metabolites of plants that work to protect the plant from pathogens and ultraviolet radiation. They have the ability to protect and fight cardiovascular diseases and many other ailments. Their own protective mechanisms have the ability to protect those who consume them. Consumption of antioxidants can reduce levels of oxidative damage, which is a result of an overabundance of free radicals in the cells to lymphocytic DNA. This will limit the risk of degenerative diseases like atherosclerosis and cardiovascular disease that are often a result of oxidative stress. Certain polyphenols have the ability to relax arteries, lower blood pressure, and thereby reduce the risk of myocardial infarction and cardiovascular diseases. Aging causes the increase of free radicals in the cardiovascular system because of the amount of oxidative stress that occurs throughout a lifetime, and it is more acute when pathological inflammation is present. Free radicals can damage or kill cells, DNA, RNA, and other important proteins. This can be helped and inhibited through the use of medicinal plants, as antioxidants are extremely helpful in combating these radicals and will help fight cardiovascular diseases. The plant compounds will limit the risk of degenerative diseases like atherosclerosis and cardiovascular diseases that are often a result of oxidative stress. The approximate macronutrient breakdown of the Mediterranean diet is 55% carbohydrates, 50% protein, and 30% fats. It consists of daily consumption of whole grains like pastas, breads, brown rice, barley, and more, olive oil, dairy products like yogurt and feta cheese, 2 to 3 servings of vegetables, 6 servings of fruit, and 100 to 200 milliliters of red or white wine, preferably with meals. It also consists of weekly consumption of 3 to 4 servings of eggs, potatoes, poultry, and 4 to 5 servings of fish, 3 servings of nuts, olives, and pulses, and 3 to 4 servings of sweets. It also includes monthly consumption of 4 to 5 servings of meat products. The Mediterranean diet is important in cardioprotection and health and is able to reduce oxidative stress, weight, blood pressure, and cardiovascular disease, morbidity, and mortality, and improve vascular functions and lipid profiles. It has been proven to prevent and aid in the healing of coronary heart disease and several other ailments. In a 7-country study, it was proved that the Mediterranean countries had much lower instances of cardiovascular disease when compared to countries that do not follow a Mediterranean diet. Those who follow the Mediterranean diet had a 50 to 70% lower risk of developing recurrent cardiovascular disease than those who follow the standard American diet. They are less likely to suffer from acute coronary syndrome, thrombosis, hypertension, diabetes, and other related ailments. The foods that it consists of have anti-inflammatory effects, and can enhance endothelial and platelet function and glucose metabolism, while also decreasing reactive oxygen species and inflammation. It can prevent important risk factors for cardiovascular diseases like high lipid glucose waist circumference and blood pressure, as the food that it consists of have anti-inflammatory effects that can enhance endothelial and platelet function and glucose metabolism, while also decreasing reactive oxygen species and inflammation. Medicinal plants have been used for centuries to treat cardiovascular ailments, including congestive heart failure, systolic hypertension, angina pectoris, atherosclerosis, cerebral insufficiency, venous insufficiency, and arrhythmia. Research has shown that garlic, arjuna, guggle, and hawthorn all have chemical properties that can fight cardiovascular diseases. Atropine is a drug derived from the Atropobelladonna species, or deadly nightshades, and has been shown to have the ability to reduce heart rate and thus heal and prevent bradycardia. It is a muscarinic receptor antagonist, which means it will bind to muscarinic receptors, which are protein receptors involved in our rest and digest response, and prevent acetylcholine, an important neurotransmitter, from activating and binding receptors. This will cause the activity of the nerves to be blocked and will increase the heart rate and speed at which nerve signals are transmitted. These effects are important because too much nerve activation on the heart causes sinus bradycardia, AV nodal blocks, and more. Digitalis is a plant that contains defensive compounds that have been proven to have a positive effect on the heart function of animals. It is extremely useful in the treatment of cardiovascular disease and has been used to treat several ailments for centuries. It is a pharmaceutical derived from the leaves of a flower plant, foxglove, or Digitalis lanata. The drug has been shown to slow the ventricular rates of patients with heart failure, increase blood flow, lower heart rate and central nervous pressure, and decrease left ventricular end-diastolic and systolic volumes and end-diastolic pressure. Through implementation of digitalis therapy, patients have shown to have increased VO2 max and exercise capacity, symptomatic improvements, increased left ventricular ejection fraction, which is how much blood is being pumped out of the heart, improved blood flow during exercise and at rest, decreased heart rate, and several other positive effects in treating heart issues, including heart failure and atrial fibrillation and flutter. In conclusion, plants have the ability to prevent and treat cardiovascular disease. Balanced diets rich in plant foods have been proven to prevent cardiovascular diseases. There are several herbal plants that have the ability to fight cardiovascular diseases and have the potential to become pharmaceutical drugs. Diets with high antioxidant content are extremely beneficial for longevity and health, particularly heart health. Plants should be incorporated into your diet to prevent and treat cardiovascular disease and can be manufactured into useful medicines to treat various cardiovascular issues. I would like to give a huge thank you to everyone who helped me with this project. I could not have done it without you all. I would especially like to thank Professor Barry Thompson, whose suggestions and feedback allowed me to finish this project. I would also like to thank my family for teaching me and my amazing boss who allowed me to look at patient test results, EKGs, and to see how he deals with patients who have all of these cardiovascular ailments, particularly heart disease and heart failure. Thank you all.